Heinzel. I'm practicing at the Medical University of Graz.
How are patients currently diagnosed with AF?
The standard is to diagnose AF is the ECG. So you have to, in some way, document the rhythm to diagnose AF. AF often presents with symptoms. Symptoms can be palpitations, so irregular pulse, or stops in the pulse if you want, but also dyspnea, so shortness of breath, that may manifest when heart failure comes with atrial fibrillation.
And you had mentioned in terms of screening tools today during the symposium, the CHA2DS2-VASc score. Do you think that's the best scoring method for the detection of atrial fibrillation?
I think what we have to realize is we need to have a bunch of factors that may trigger AF to identify the patients. The beauty of the CHA2DS2-VASc score is that this score also gives you a risk of thromboembolism once you have AF detected. So it may be a combined risk score for developing AF with complications.
Do you think that implanted devices implicate an increase in hospital visits?
With the Reveal device, we also have the possibility of home monitoring via the CareLink device. So I think this puts us in the position that we can have a closer monitoring of patients at risks with less hospital visits. If we consider this high prevalence of silent atrial fibrillation, we cannot rely on a history of AF to identify high-risk patients.
And how should we use screening for atrial fibrillation?
We know that more than half of the patients with no paroxysmal AF may remain undetected with 7-day Holter. The role of continuous Holter monitoring has been shown in patients post-MI. This is the Charisma study that showed that you can reliably detect in these post-myocardial infarction patients atrial fibrillation, and that this is of relevance to detect it and to treat it. And I think it remains to be determined if in other high-risk patient cohorts we would also need continuous monitoring to identify patients with AF.
You had talked about the GRAPH study during your presentation. Can you tell us a little bit about that study and what you're hoping to achieve?
What we expect to see from this trial is whether, according to our theory, the Reveal, the implanted loop recorder, may give us an edge to detect patients with atrial fibrillation, the first diagnosis of atrial fibrillation, earlier than with regular care.
What are your perspectives on device management for AF moving into the future?
I think once we have identified patients that may be at increased risk for AF, depending on certain scores, we may be in the position to say it may be beneficial to implant a continuous loop recorder and continuous rhythm monitoring to device to identify those patients that really develop AF to start early with oral anticoagulations.